In this video by DeckPlate, we will get information on knee rating. Disclaimer. This video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Veterans, here's what you need to know for knee rating. In the realm of veteran healthcare, understanding the intricacies of disability ratings is paramount for those navigating the VA system. Knee and leg impairments are particularly common among veterans, often stemming from injuries sustained during military service. Knee ankylosis, diagnostic code 5256. Knee ankylosis refers to the abnormal fusion or immobility of the knee joint, resulting in limited flexibility and range of motion. The severity of knee ankylosis is assessed based on the degree of flexion restriction observed during medical evaluations. The VA assigns disability ratings as follows. Extreme unfavorable, flexion at 45 degree or more, rated at 60%. Moderate limitation, flexion between 20 degree and 45 degree, rated at 50%. Mild limitation, flexion between 10 degree and 20 degree, rated at 40%. Favorable angle, full extension or slight flexion between 0 degree and 10 degree, rated at 30%. These ratings reflect the impact of knee ankylosis on a veteran's ability to perform daily activities and engage in work-related tasks. Other knee impairments, diagnostic code 5257. Beyond ankylosis, various knee impairments can significantly affect veterans' mobility and quality of life. The VA provides specific guidelines for evaluating these impairments, including recurrent subluxation or instability and patellar instability. Recurrent subluxation or instability. Unrepaired or failed repair of complete ligament tear causing persistent instability, and a medical provider prescribes both an assistive device, for example canes, crutches, walker, and bracing for ambulation. Rated at 30%. Recurrent subluxation or instability involves a sprain, incomplete ligament tear, or repaired complete ligament tear causing persistent instability, and a medical provider prescribes a brace or assistive device, for example, canes, crutches, walkers, for ambulation. Rated at 20%. B. Unrepaired or failed repair of complete ligament tear causing persistent instability, and a medical provider prescribes either an assistive device, for example, canes, crutches, walker, or bracing for ambulation. Sprain, incomplete ligament tear, or complete ligament tear, repaired, unrepaired, or failed repair, causing persistent instability. Without a prescription from a medical provider for an assistive device, for example, canes, crutches, walker, or bracing for ambulation. Rated at 10%. Patellar instability, a diagnosed condition involving the patellofemoral complex with recurrent instability after surgical repair that requires a prescription by a medical provider for one of the following: a brace, cane, or walker. Rated at 10%, 20%, or 30%, depending on the severity and management of the condition, including the need for bracing and assistive devices. For patellar instability, the patellofemoral complex consists of the quadriceps tendon, the patella, and the patellar tendon. A surgical procedure that does not involve repair of one or more patellofemoral components that contribute to the underlying instability shall not qualify as surgical repair for patellar instability, including, but not limited to, arthroscopy to remove loose bodies and joint aspiration. These ratings take into account the functional limitations and medical interventions necessary to manage the respective knee impairments. Cartilage and leg impairments. In addition to knee-specific impairments, veterans may experience cartilage issues and limitations in leg flexion and extension, which can significantly impact mobility and overall function. The VA evaluates these impairments using the following diagnostic codes: cartilage, semilunar, dislocated, with frequent episodes of locking, pain, and diffusion into the joint, diagnostic code 5258, rated at 20%. Symptomatic cartilage removal, diagnostic code 5259, rated at 10%. Leg flexion limitation, diagnostic code 5260, rated based on the degree of flexion limitation, ranging from 0% to 30%. Flexion limited to 15 degree, rating 30%. Flexion limited to 30 degree, rating 20%. Flexion limited to 45 degree, rating 10%. Flexion limited to 60 degree, rating 0%. Leg extension limitation, diagnostic code 5261, rated based on the degree of extension limitation, ranging from 0% to 50%. Extension limited to 45 degree, rating 50%. Extension limited to 30 degree, rating 40%. Extension limited to 20 degree, rating 30%. Extension limited to 15 degree, rating 20%. Extension limited to 10 degree, rating 10%. Extension limited to 5 degree, rating 0%. These ratings reflect the impact of cartilage and leg impairments on a veteran's functional capacity and overall well-being. The VA's disability rating system provides a framework for evaluating and compensating veterans for knee and leg impairments incurred during military service. By understanding the diagnostic codes and corresponding ratings, veterans can navigate the claims process more effectively and access the support and resources they need to manage their disabilities. It is essential for veterans to work closely with healthcare providers and veteran service organizations to ensure their disabilities are accurately assessed and appropriately compensated by the VA. Thank you for watching this video. Please don't forget to subscribe and like our videos.